Healthcare access is broken. Patients prioritize convenience. But what if care could move at the speed of need? From access to action, from intake to outcomes, from chaos to clarity. No more dead ends, no more dropped handoffs. Witness the Great Access Center Reset.
Hello and welcome everyone. We're so excited to have you here for the official launch of Comet by Innovacer. Joining me here today are several esteemed guests. We have Dr. David Nace, our Chief Medical Officer here at Innovacer. We have Abhay Prasad, our Chief Product Officer at Innovacer. We have Aaron Boer, AVP of Clinical Transformation at Innovacer. And I'm Shira Haushin, the Chief Experience Officer at Innovacer. This is more than a new brand launch. It's actually a turning point for how we think about access centers. We've done our homework over the last few months, listening, really listening, to patient access center leaders and their teams, as well as to patients. And what we heard from all of them is that the current system for access systems is just not sustainable anymore. So today, we're introducing something that we built specifically for access centers. We're going to spend time today talking about our Access Center AI solution, Comet. If at any point during this discussion this feels like something you and your organization need, or you just have questions, scan the QR code on your screen or drop us a note in the chat to request a demo or simply to ask a question. And now for the exciting part, the reveal. We'll watch a video in which we share our new solution, Comet. But stay with us because in 30 seconds we'll come back together to talk as a panel about access center challenges and to see a demo. Let's see this.
You've built a world-class healthcare system, but when patients can't get through, it doesn't feel that way. Right now, someone is waiting on hold. Another one just hung up because access centers are buried in low-value, repetitive work. Staff is burning out, and yet, access remains broken. What if technology handled the routine so that people could focus on the critical? It's time to unleash your always-on digital workforce. Meet Comet, your AI-powered access center solution. Instant, any channel, any patient, 24/7. Comet by Innovacer.
This is exciting. So let's start first by talking about the problem that we're trying to solve. Dr. Nace, given your expertise as Chief Medical Officer, I'd love to hear what you think about this from the provider perspective.
Thank you, Shira. I'd be happy to. Access centers are the front door to health systems, and that front door is jammed. Health systems have spent years investing in digital solutions, but the access center just hasn't kept up. Patients are still waiting on hold, bouncing around between departments, and then dropping off before they ever get scheduled.
Well, that comes at such a cost. It's a high cost. When calls to the access centers go unanswered, it's not only the patient's experience that's affected, it's their care because they miss appointments and miss care entirely. It affects the providers too, in that it hits their bottom line. Estimates show that broken access center care workflows lead to nearly $1 billion in loss of revenue. And that scale of loss limits the provider's ability to actually offer expanded access to care and serve their communities.
And it's not just about the dollars. 59% of patients prefer convenience over network loyalty, and they'll switch providers if the experience is not easy. Nearly half of all administrative spend in healthcare in this country today is wasted, much of it on outdated manual processes.
Yeah, and the result is an access center under pressure. Agents are handling fragmented workflows with minimal support. Patients are stymied by the wait times. The average wait time is about 4.4 minutes. And most patients, all of us, drop off well before the 2-minute mark. That is really not sustainable.
It's not, and it's not what patients want either. I think there's such a disconnect between what patients want and expect and what providers can offer. If you think about it from the patient experience perspective, we're all consumers. And in every industry except healthcare, you have multiple different options. You can use chat, you can do text, you can do a website, you can do app. But in healthcare alone, when you're at your most vulnerable and when you just want to reach someone, you have only one option, a phone call.
Which is amazing when you think about it, just one method. I think this shows that we've reached a point where access isn't just inefficient, it's actively holding our health systems back. The tools don't talk to each other, the workflows aren't intelligent. The demand cannot be met with the existing staff that health systems have. We're working, for example, with a health system which is unable to address about 80% of the referrals it gets per day because they just don't have enough people.
Healthcare is different. When patients reach out, it's not just because they're at their most vulnerable, it's because they need help quickly. But the reality today is stark. Wait times have stretched so far that there's countless patients who need appointments, and they're forced to wait months, if not up to a year, and that's not unusual. When one's health care is on the line, they can't afford to wait that long, and they'll go elsewhere.
Absolutely. And that's exactly why we built Comet, to fix the foundation and to help people have the experience that they've been asking for, and also to help providers with the frankly unsustainable administrative costs of our current Access Center setup. It also helps in preventing revenue loss, and that means that our providers can continue to help their patients. So with that, it would be nice to hear about Comet itself. And this is where, Abe, as the Chief Product Officer, I'd love to hear more about your vision for Comet.
And I'd love to talk about it. We designed Comet to meet the real needs of access centers today with an eye on the future so that it is future-proof. It's more than automation, it's orchestration of people, of signals and systems. It integrates directly into the tech infrastructure that health systems already use, whether it's the EHR, your telephony systems, or your CRM. It's meant to elevate those systems versus require them to be replaced. We have solved for both health systems and patients. For patients, we want to deliver 24/7 support, self-service, and digital channels with a level of personalization that makes sure that the context from one interaction is carried over to the next so that patients don't have to repeat themselves. There are three key parts to our solution. One, a family of virtual agents. Two, an Access Center solution with an embedded copilot. And three, a referral copilot with an AI scheduling agent. Let's take these one by one. First of all, our family of virtual agents provide 24/7 support to customers on FAQs, appointment booking, eligibility verification, all the common reasons people call a health access center. Our virtual agents are available on voice, web, text. They can handle both incoming and outgoing calls. And we think more than 70% of all calls coming into access centers today can and will be handled by virtual agents, leaving our human access center teams for the most complex cases. Second is our Access Center solution, which provides a single unified agent desktop for a human agent. It is supported by an embedded Access Copilot that generates an AI patient summary. It provides next best answer guidance to the call center agent as a call is happening, and it provides automatic call summarization, saving the agent a lot of time. Our Access Center solution with its Copilot, with our earliest customers, has shown more than a 30% increase in agent productivity, which is really big in the Access Center world.
That's incredible. Yeah.
Yeah, it is, and it has been exciting to see. Our third element, the referral copilot and scheduling agent, significantly cuts down the time it takes to process a referral. About 30 to 50% of referrals never get addressed in time by the health system, and that's a significant revenue drain leakage for them. With our referral copilot working alongside the scheduling agent, health systems can increase the conversion rates by 20 to 30 percentage points. And of course, we have the analytics to measure, track, and optimize performance across all of these.
And the kicker to all of this is it comes fully integrated with your EHR and your telephony system.
That's right. There is no need to rip and replace. Comet plugs in and elevates whatever is already working. So let's see it in action. And to do that, I'm going to pass it over to Erin Bohr, our AVP of Clinical Transformation.
Perfect. Thank you, Abhay. Let's dive in. As we've noted, patients expect the same experience from healthcare as they do from industries such as e-commerce. These industries prioritize experience and are heavily reliant on digital channels, but in healthcare, we see systems continue to route access requests through traditional voice channels. Now imagine the experience of patients like Jason, Rachel, and Joy, each with different preferences, all forced to navigate the same outdated experience. Rather than receiving immediate support, they're met with messages like, your wait time is approximately 5 minutes. But they won't wait 5 minutes. Most patients abandon calls after just 2 minutes, and just like that, another patient is lost in the system, resulting in missed revenue and delayed care. What's more concerning is that this isn't just a one-time missed appointment, it's a lost lifetime value opportunity. After a poor access experience, these patients are far more likely to switch providers entirely, turning an operational inefficiency into a long-term retention issue. On the other hand, an agent is trying to keep up. They're bouncing between multiple systems: telephony, EMR, scheduling tools, a static knowledge base, billing, and none of it talks to each other. So forget about one-call resolution, even just finding basic information: who the patient is, whether they're eligible, what appointments are available. It just takes too long. And it's a disconnected workflow that leads to long handle times, dropped calls, unfilled schedules, and billions in missed revenue across the industry. This isn't just inefficient, it's unsustainable, and it's exactly what Comet is built to change. So what if Access looked different? What if patients could get what they need on their preferred channel at their preferred time without waiting on hold or being bounced around? What if your staff could focus on people and not process? That's exactly what Comet enables. It brings together omni-channel virtual agents, AI copilots, and automated workflows, which serve as the first line of engagement and enables patients to reach out to health systems on their preferred channel at their preferred time. It also removes wait times completely, enhancing patient satisfaction and ultimately retention. Every interaction is personalized, intelligent, and built for resolution. Let's see how this works by looking back at Rachel, Jason, and Joy. Let's start with Rachel. But this time, instead of calling, she can reach out to the health system over web chat based on her own convenience. This time, she's greeted by a simple, smart interface. She selects what she needs to book an appointment for herself, which in particular is an annual wellness visit, and in the background, Comet gets to work. It recognizes Rachel from past visits. It's going to verify her identity. It's going to ask her the reason for her appointment, and it's going to pull up the right appointment types, providers, and slots. Once Rachel chooses a slot, and immediately the appointment is scheduled, the EMR is updated, and Rachel receives a confirmation text with the visit details. Had Rachel needed further assistance with something like clinic directions, parking instructions, benefits and eligibility checks, provider search, or even password resets, that could have been handled as well. It's fast, easy, and it's available 24/7. This is what it means to meet patients where they are. Now let's meet Jason. He's in his 20s, busy, and like a lot of patients, he would rather text than call. He needs to reschedule his appointment, so he reaches out, and just like that, Comet steps in immediately. That's it. No app, no call center wait. It's going to confirm his identity using his full name plus a quick date of birth prompt, and then it's going to pull up Jason's current appointment. It's going to ask his preferences for a new appointment, and it's going to provide him with another appointment slot, confirming the new time, updates to the EMR, sending it a new confirmation by text, and then automatically queuing up any follow-up workflows like check-in instructions or pre-visit forms. That entire flow, personalized, HIPAA compliant, and done in under a minute. This is how Comet turns a missed appointment into a scheduled one without ever touching your staff. Now we have Joy. Joy prefers to talk to a person when it comes to matters of her health. Our AI agents can identify that preference and pass to a human agent via warm transfer or sending to an escalation queue. The moment Joy's call is escalated to a human agent, Access Copilot gets to work. Using caller ID, it's going to auto-detect Joy's number and instantly uses AI insights from her 360-degree profile to show a single pane of glass in view with Joy's most recent engagement. It's also going to show any open care gaps, her preferences such as language and communication channel, her recent visits, her active insurance plans. The agent doesn't have to dig or ask repetitive questions because the Copilot surfaces what they need to know within a few seconds of the call. And while the call is happening, the Copilot is listening in real time. Based on the conversation, it's dynamically going to suggest the next best action, knowledge base articles, and smart responses. Not just that, Copilot can also see that Joy has an open annual wellness visit care gap, and it gives the agent an appointment nudge to remind her that Joy needs to schedule that and make sure that she makes that appointment. Again, what could have been a missed care opportunity is now a booked appointment in just a few clicks. The agent can do that right in the same view thanks to our robust EMR integration. And once the call wraps up, the Access Copilot automatically generates a call summary, fills in the necessary ticket fields, and logs the transcription of the conversation. This is going to reduce the need for double documentation and saves about 25% of the total call handle time per agent while improving documentation quality and enabling better care. Not only can we handle scheduling, but we also address referrals, which we know are one of the biggest pain points in Access. They often arrive via fax or email, and they take 10 to 15 minutes to review. They then require your team to manually extract information, verify insurance, and call the patient to schedule. With Referral Copilot, all of that changes. Let's look at how Joy's ortho referral gets processed. The moment the referral is received, whether from fax, EMR, or intake form, it's going to land in the referral work queue. The coordinator clicks into the row for Joy Lawson, and right away, Referral Copilot has already done the heavy lifting. It extracted all of the key referral details, it's populated the patient header with insurance, contact information, and PCP, and it summarized the referral reason, urgency, and provider requirements, along with flagging any missing data. On the right-hand side of the screen, the AI Insights panel is live. It gives real-time tips to move the referral forward, whether the coordinator is reviewing documentation or live on a call with the patient. In addition to any of this information here, the Referral Copilot can also verify insurance in real time. Need to confirm a prior auth is complete? That's also tracked, with status and comments added right into the platform. Once all of the pre-scheduling steps are complete, the coordinator then updates the status to ready for scheduling, and at that moment, the referral automatically moves to the AI scheduling agent's work queue, no handoff emails, and no delay. Now the best part, our AI voice agent, which supports both inbound and outbound calling. As soon as Joy's referral goes to the AI scheduling agent queue, the scheduling agent picks up from the task from the work queue, and then it's going to initiate a proactive outbound call. Our AI voice agents can reach patients outside of their 9 to 5 workday and reach out on weekends based on the patient preferences, increasing the likelihood that an appointment gets booked. Our voice agents are humanistic, cover a wide variety of patient questions, and support over 10 major languages. So let's listen to what a call actually sounds like.
Hi, this is Sarah, an AI agent from Innovator Health. Am I speaking with Joy?
Yes, this is Joy.
I'm calling because your primary care physician, Dr. Patel, referred you to see an orthopedic specialist, and I'm here to help you schedule an appointment. Before we proceed, I want to make sure you're comfortable talking with me as I'm an AI agent. Is that okay with you?
Oh, yeah, that's fine.
Just to make sure I have the right Joy, could I get your last name?
Yes, it's Lawson, Lawson.
And your date of birth?
Yeah, my date of birth is August 15th, 1956.
And is your insurance still UHC Vantage Plan?
Yes, that's correct. That's active.
Okay. To help me narrow down some options for you, can you tell me, do you have a preference for either the Holiday Hills or Main Street location?
Holiday Hills location, please.
And is this appointment a follow-up to an ER visit?
No ER visit.
All right, I've got a few options for you. How about Wednesday, July 30th at 9 o'clock a.m. with Dr. Sam Johnson?
Do you have anything in the afternoon?
Wednesday, July 30th at 1 o'clock p.m. with Dr. Aloha Roberts?
That's great.
So I've scheduled your appointment for Wednesday, July 30th at 1 o'clock p.m. with Dr. Aloha Roberts at the Holiday Hills location. Do you have any questions about your upcoming appointment, or would you like some information about the location?
I would like some information around the location and parking directions.
The Holiday Hills location is at 7 Holiday Hills. As for parking, there's a large parking lot right in front of the building, and it's free of charge. You can just park there and then walk into the building, and our office will be on your right.
Oh, great.
So just to confirm, your appointment is scheduled for Wednesday, July 30th at 1 o'clock p.m. with Dr. Aloha Roberts at the Holiday Hills location. I appreciate you taking the time to schedule this appointment, Joy, and I hope everything goes well. Have a great day, and we'll see that you're taken care of.
Two things were handled on this call: referral scheduling and frequently asked questions. And we can see that the AI voice agent uses provider scheduling rules and decision trees to find the best provider for Joy and integrates with the EMR to write back appointments. With Comet, outbound outreach becomes consistent, efficient, and scalable. So how do you know this is working? Comet makes that easy by giving you a clear, real-time view of how your Access operations are performing. The status quo has always been an agent on a call with a patient for at least 15 minutes or more. Meanwhile, there are 10 patients waiting for more than 5 minutes to connect with an agent, leading to frustration. Frustration then leads to drop-off, which leads to the patient not getting scheduled and thus revenue leakage. We're flipping that. At the highest level, you can track how many interactions are being resolved by AI versus those handled by the staff. You can quickly see where automation is delivering and where additional support or optimization may be needed. The platform also shows how patients are engaging, whether they prefer chat, voice, or SMS, and how effective each channel is at getting patients what they need. You can monitor call abandonment rates, CSAT, how long it takes to resolve patient issues, which gives patient experience leaders the insights that they need to improve services. And for operations and finance leaders, the productivity dashboard tells a powerful story. You'll see how many appointments are being booked, how quickly issues are resolved, what the cost per interaction is, and then you're able to see how that translates into a single ROI view. You're not left wondering if your Access investments are paying off. You can see it and measure it with confidence. And so with that, I'm going to pass this back to Shira and the rest of the panel.
Thank you so much for the demo, Erin. So to summarize what we've just shown you, this is the omnichannel experience that patients have been asking for. It gives them the ability to do self-service, to be able to call in when they need and get what they need. And it frees up your Access team to be able to focus on the more complex, high-touch moments when you actually need human connection.
Exactly. It allows Access team members to deal with the complex queries that reach them on any channel much more productively than they can today. And this means shorter wait times for all your patients without increasing team sizes.
And I think there is actually one element I want to touch on from Erin's demo, which is around the referral aspect, because I think this is really a leading edge referral solution in that it can significantly increase referral conversion and accelerate access to care for patients. So for that, actually, Dr. Nace, I'd love to get your perspective from the provider's perspective.
It's a great question, but let's zoom out for a minute and think about where healthcare is today. Healthcare is undergoing a seismic shift in consumer expectations, workforce shortages, and margin pressures. What worked yesterday is really breaking down today. And when access breaks, everything breaks. Patients don't show up, clinicians waste time, and more importantly, care is delayed. So Comet is really an example of the right solution at the right time. Because it does more than digitalize, it orchestrates. It connects people, systems, and insights. So let's fix the front door. Let's deliver the kind of access your patients demand and that health systems need. We're not just improving access, we're restoring trust in the front door of healthcare.
And that's really what it's all about, right? Trust, providing healthcare, helping providers help their communities. That's what we're aiming to do here at Innovacer. And with that, let's open it up for questions. If you haven't already, drop us a note using the link in your chat or scan the QR code. We'd love to talk to you. To everyone watching, thank you. We know the pressures that you're under, and we built Comet with you in mind. We're looking forward to sharing it with you. Thank you.